One thing we don't know a lot about, and I would personally like to learn a lot more about, is the effect of trying a series of medications. And there's a very good rationale for doing that from the medical perspective. It's how you can make sure that you're getting the right medicine to the right person at the right time, you're getting the right combinations, and you're able to use the lowest doses.
Yes.
On the other hand, if you're the patient, it just feels like a lot of, uncertainty and a lot of big question marks. Haven't you guys figured this out yet? From a patient's perspective, to have a series of medications not work well enough for them, I think it becomes easy to kind of give up and say, well, let's just stop here. I'm good enough. I'm better than I was. But we're not always sure that they're as good as they could be.
And I think even as the patient's rheumatologist, you're sometimes on the fence of how hard do you push, and it's a discussion of what are your goals in life, what do you need to do in life. Also, it's a do you see damage starting to accrue, and can you do better without creating undue risk? And that's where the sort of call it shared decision making comes into play, because on the one hand, a patient does not want to take anything that's going to risk their health. And on the other hand, they want to max out in terms of how good their RA can be.
And I remember, I think it was one of your patients in one of the groups had said, it also depends where they are in life. One woman talked about starting a new medication, and she said it made her very tired. It meant that she needed to go to bed earlier at night, and she slept in longer in the morning. But she said, you know what? That's okay, because I'm 55 and my kids are grown and I don't have to get them out the door, and I can take myself to bed when I feel like going to bed. She said, I couldn't have done that 10 years ago.
Yeah, yes. And what I've done is with patients is ask them to continue trying. We're going to do all of these things to help it, and let's see if it turns around. There are so many issues to manage and deal with.
One of the things I was really encouraged by was looking at how well and how quickly most people adapt. And the reality was, we saw in our catch data that within 3 to 6 months, the vast majority are so much better. Not only is their disease better, but their sleep is better, their mood is better, their quality of life.
We get them into remission faster. And we're seeing people, upwards of 60% of people so that's 6 in 10 people who are getting their disease under good control. And as soon as that happens, especially if it happens quickly, fatigue gets better. As you say, sleep gets better, energy gets better, pain gets better, life can happen again.
Mood gets better. You feel willing to make a commitment, like to decide you're going to have a holiday together, to commit to a vacation. And there's the confidence, I think I can do this. And it comes, as you say, relatively quickly for the vast majority of people. But gosh, sometimes I can imagine just how hard it is in those early days to see that you'll find a new routine. It will work, and it'll fall into place fairly soon.